What happens during a heart attack? Imagine you're sitting at home watching television, driving to work, or simply walking down the street. Suddenly, a tight pressure begins to build in your chest. At first, you think it's just indigestion, stress, or maybe fatigue. But within minutes, that discomfort becomes more intense. Your chest feels heavy. You may start sweating. Breathing becomes difficult. Pain may spread into your arm, neck, jaw, or back. What you're experiencing could be a heart attack. But what exactly is happening inside your body during a heart attack? Let's take a journey inside the human heart to find out. Your heart is an incredible muscular organ about the size of your fist. Every single day, it beats around 100,000 times and pumps thousands of liters of blood throughout your body. To perform this non-stop work, the heart needs its own supply of oxygen-rich blood. This blood is delivered through special blood vessels called coronary arteries. Think of these arteries as highways that deliver oxygen and nutrients directly to the heart muscle. As long as these highways remain open, the heart functions normally. However, problems can develop over many years. Inside the walls of coronary arteries, fatty deposits called plaque can slowly accumulate. This process is known as atherosclerosis. Plaque consists of cholesterol, fat, calcium, and other substances found in the bloodstream. Over time, these deposits make the arteries narrower and less flexible. Many people don't realize they have plaque buildup because it often causes no symptoms for years. Then comes the dangerous moment. A plaque deposit suddenly cracks or ruptures. Your body treats this rupture like an injury. Blood platelets rush to the area and begin forming a clot. Normally, blood clots help stop bleeding after an injury. But inside a coronary artery, this clot can become a serious problem. The clot may rapidly grow large enough to completely block blood flow through the artery. The oxygen highway is suddenly shut down. And that's when a heart attack begins. The medical term for a heart attack is myocardial infarction. Cardio refers to the heart. Myo means muscle. And infarction means tissue death caused by a lack of blood supply. The moment blood flow stops, the affected area of heart muscle is starved of oxygen. Heart cells are extremely sensitive to oxygen deprivation. Within minutes, these cells begin to suffer damage. As time passes, more and more heart muscle starts dying. This is why doctors often say, time is muscle. The longer treatment is delayed, the more heart tissue can be permanently damaged. While this is happening inside the heart, the body starts sending warning signals. The most common symptom is chest pain or pressure. Many people describe it as feeling like an elephant is sitting on their chest. Others report squeezing, burning, fullness, or tightness. The discomfort can spread into the left arm, both arms, shoulders, neck, jaw, or upper back. Shortness of breath often occurs because the heart is struggling to pump effectively. Sweating may become intense and sudden. Some people feel nauseous or begin vomiting. Others experience dizziness, weakness, or an overwhelming sense that something is seriously wrong. Interestingly, symptoms are not always dramatic. Women, older adults, and people with diabetes sometimes experience unusual symptoms. These can include fatigue, indigestion-like discomfort, jaw pain, back pain, nausea, or shortness of breath without significant chest pain. Because symptoms vary, many heart attacks go unrecognized during the early stages. Inside the blocked artery, the situation continues to worsen. The oxygen-starved heart muscle becomes electrically unstable. The heart's normal rhythm may become disrupted. Dangerous arrhythmias can develop. Some arrhythmias cause the heart to beat too fast. Others make it beat chaotically. In severe cases, the heart can stop pumping blood effectively altogether. This condition is known as cardiac arrest. Without immediate treatment, cardiac arrest can become fatal within minutes. Fortunately, modern medicine can often save heart muscle if treatment begins quickly. Emergency medical teams use tests such as electrocardiograms, often called ECGs, to examine the heart's electrical activity. Blood tests can detect proteins released by damaged heart cells. Once a heart attack is confirmed, doctors work rapidly to restore blood flow. One common treatment is coronary angioplasty. A thin tube called a catheter is inserted into a blood vessel and guided to the blocked artery. A tiny balloon is inflated to open the blockage. Often, a small metal mesh tube called a stent is left behind to keep the artery open. Another option involves clot-dissolving medications that help break apart the blockage. The goal is always the same: restore blood flow before too much heart muscle dies. After blood flow returns, the healing process begins. Some damaged cells may recover if oxygen is restored quickly enough. However, heart muscle that has died cannot regenerate completely. Instead, scar tissue forms in the affected area. Depending on the extent of damage, the heart may continue functioning normally or may become weaker. The good news is that many heart attacks are preventable. Maintaining healthy cholesterol levels, controlling blood pressure, exercising regularly, avoiding smoking, managing diabetes, and eating a heart-healthy diet can dramatically reduce risk. Your heart works tirelessly every second of your life. Understanding what happens during a heart attack could one day help save your own life or the life of someone you love. If you ever suspect a heart attack, don't ignore the symptoms. Seek emergency medical help immediately. Remember, every minute matters because every minute can mean more heart muscle saved. And that's exactly what happens during a heart attack. This video is for educational purposes only and should not replace professional medical advice. Subscribe for more human anatomy and medical science videos.